Hello, everyone. Welcome. Welcome to our conference on closing the digital divide. This is sponsored by the Fordham Institute for Women and Girls, cooperation with the International Health Awareness Network. We're very pleased to be putting on this conference together. I also want to acknowledge the person who gave us this idea for the conference, to Roshan, who wasn't able to be here today, but she mentioned to me last summer, and that's when we started to plan for this conference. I'm co-chair of the Fordham Institute for Women and Girls, and I co-chair with Sandy Turner, who's just retired faculty from Fordham. I'm associate dean and professor at Fordham, and we're real pleased that we've really worked very hard. Our planning committee, and we have Pat Brunell, who is a former co-chair of our committee, retired faculty. We have David Melnick from IHAN. We have Vijay Melnick from IHAN, who you'll hear from him later. We have Edward Brewer, we have Christian Triglia, Rachel Gentile, and Liliana Otero. And last but certainly not least, we have Frankie Heppel. And she is a person who really helped pull this all together. And I'm sure you probably have seen some of her emails in terms of the program and all. I also want to have a special thanks to our Fordham IT staff, who have just been wonderful. We have Connor White, we have Matt Roach, and Trish Rodriguez, who really have pulled this conference together for us. Now I'm going to turn the program over to Frankie Heppel, who will take us from here.
Thank you, Dr. Congress. Hi, everyone. I'll be very brief. I'm just wanting to orientate you to the format this evening. We have a packed agenda with speakers from all over the world, and we are going to open the chat for any questions that you might have going through the presentation. And at the end of the conference, if you have any further questions, there'll be more time there. I'm going to put in the chat right now what the order will be, and then I'm going to hand back to Dr. Congress, who will introduce our first speaker, Peter Mandra.
Okay. Again, well, I wanted to introduce our speaker, Peter Mandarick, and he is the general manager of Close the Gap. Now, at Fordham, we've had a long relationship with Close the Gap. I've been very involved with the UN, and this is one of the NGOs that we've worked with for many years, and I've had students associated, with them. And Peter has worked with Close the Gap since 2007. And you may wonder what Close the Gap is all about, and he'll tell you much more. But what I've been so impressed by, they really are involved, and it's really a kind of a partnership between the profit and the nonprofit world. They really are involved in taking computers that a lot of businesses are getting rid of and recycling them to places in the world that really need them, such as in Africa. But it's not just that they just drop them off there. They were very involved in training and in education. So they really are closing the digital gap in terms of the work that they do. So without further ado, let me turn the program over to Peter. You're on.
Hi, my name is Peter. Thank you for inviting me to present our organization tonight. Let me share my presentation. So I'm the general manager at Close the Gap. I joined the organization about 16 years ago, and the organization itself turned 20 a couple of weeks ago. Close the Gap was established with the goal to bridge the digital divide. And we do that with, I'd say, a social business mindset. We've developed a business model as a nonprofit organization that enables us to carry out our activities without being dependent on grants or any government subsidies. Basically, our focus is on providing sustainable and access to ICT for disadvantaged and vulnerable communities around the world. So we do that in the model that we created by contacting mostly the private sector companies, small and large, from SMEs in Belgium up to the multinational companies like Coca-Cola, for example, worldwide. We ask them to donate the computers that they use for 4 or 5 years and then dispose of and replace them. We ask them to donate those devices to our organization. And we work together with a couple of professional refurbishing partners that go and collect those devices on our behalf and do a thorough test of the device itself to make sure it's still fully functional. If that's not the case, they do some necessary repairs, etc. What's also very important in that process is that they do a certified data wipe. That's one of the main worries when you talk to companies and also to governments today is the protection of their data. So it's very important for us that they can rely on our process, that their data is safe and will be destroyed before the computers are reused. With that reuse, we have a social impact in mind. Our goal is to give access to IT to communities. It's mostly in an educational sector around the world. And we do that in collaboration with local partners. Like Dr. Congress told, providing the IT device is one thing, but you need to have the framework around that to make sure that the device is used in a sustainable manner, that there is the local knowledge available to install the devices and give training and train the youth or the next generation of entrepreneurs on how to use the device, and then ultimately use the power of technology to develop themselves, but also to overcome some of the challenges that they face in their context. That's the work that we do under the name of Close the Gap. But then to close the loop, we also established a second organization called World Loop to make sure that we minimize the environmental impact of our organization. There is an important environmental impact in reusing computers, which I will come to later. But even then, sooner or later, it will end up as an obsolete device. And we want to make sure through our World Loop program that we recover as much of those devices at the end of their second life and make sure that they are recycled in a proper manner, recover as much of the rare metals, the valuable materials to produce new equipment again as well. We have projects, like I said, all over the world in more than 50 countries since we started. Last year, 2022, we supported projects in about 23 countries. You can see on the map, they are all over the place, but when you look at the volume of the devices that we ship, most of the volume is going to Eastern Africa, where we also have our own hub in Mombasa since 2019. This year, we created 2 additional hubs, one in Cape Town, South Africa, and a second one in Kinshasa, RDC, to expand our activities in those regions as well. We've collected in those 20 years more than 1.2 million ICT devices. That's really everything. We offer the companies to donate all their ICT equipment, which also means that we receive about 30% of ICT waste. We make sure that that part is properly recycled within Europe, so that will not be shipped to Africa. We only reuse the good devices, and with those devices, we've supported more than 8,000 projects and we estimate that we've reached more than 5 million beneficiaries in those 20 years. As I said, we have a societal impact first. If you look at the worldwide numbers, still more than half of the population does not have access to ICT at home or even in their surroundings. So by offering high quality, low cost IT equipment, we can improve that digital divide, bridge that digital divide. That's our main goal. But we want to generate an environmental impact at the same time by giving computers a second life. In that way, you avoid a lot of pollution and CO2 emissions that are generated during the production phase, because that's where the largest part of the pollution and the CO2 emissions take place. So by extending the lifespan of a device with another 4 to 5 years, you have a significant environmental impact as well. We're saving about 120 kilograms of CO2 emissions by reusing one laptop. If you look at that, we are reusing about 30,000 IT devices each year. Those numbers really add up. And it's not only about the CO2 emissions, it's also about conflict minerals that are harvested by children. Reusing and recycling computer devices also make sure that we can get those practices out of the world as well. We're doing that mostly in developing countries, but also in my own country, in Belgium. We still see that there is a large digital divide. We see that almost half of the population is still considered digitally vulnerable, even though access to ICT is very available here. We still see that large part of the populations in a vulnerable background do not have the skills to properly make use of the power of technology here in Belgium as well. So that's why we created another non-profit organization called Digital for Youth back in 2019, so 4 years ago, also with the goal to distribute laptops to disadvantaged youth in Belgium. Not to the youth directly, but to social projects that work together with them to build their skills, learn them how to work with computers and develop themselves, create opportunities for themselves in their education and in potential future careers. So in total, in those 4 years, we've distributed about 20,000 devices all over the country. And there was a big uptick, especially during the lockdowns here in Belgium, as I think in large parts of the world. A lot of the schools closed as well for several months, and the students had to continue their education from home by making use of technology, platforms like Zoom, for example, and others to stay connected to the school, to the teachers. And there we noticed the digital divide became very visible, that a large part of the youth in Belgium did not have access to a device, or a family had to share one device for 4 or 5 children at the same time, which made education very difficult and created a difficult situation where they could not keep up with the schooling. And so in 3 months' time, I believe we were able to collect and distribute almost 13,000 devices over the country again. Another important project was 2 summers ago, summer of 2021. There were some devastating floods in Belgium that wiped out 10 communities in the French-speaking part of the country, and through the social welfare centers of those communities, we were also distributing more than 1,000 laptops to, again, disadvantaged families. And then more recently, because of the war in Ukraine, we also have a lot of refugees that were hosted in Belgium. And there again, we supported several projects with laptops to enable those youths, those children, to continue their education from home here as well. So that's a short version of our story. If you have more questions, feel free to contact me. You have my contact details here, and I'd be happy to share more.
Thank you, Peter. Does anybody have a question for Peter Mandarich? You can just ask it now if you do.
See anything?
Okay, so if you think of something, we'll have more questions at the end, but thank you very much, Peter.
Right. And also please feel free to contact Peter, who maybe able to say to the very end, how we always struggle with time differences around the world. But but please feel free to email him directly, because he's one of these people who will return an email immediately. So if you think of something you want to ask him, please do. It was really a very, very interesting presentation, and I thought about it's very similar to what happened here in New York with COVID, when we had the pandemic, and suddenly schools were closed down and students had to learn at home, and they didn't have the computers, especially poor kids. So there was real kind of educational problems, and I think still the students haven't caught up with really having to do everything like online during COVID. So anyway, thanks very much.
You're most welcome.
I guess Rachel.
Hi, everyone. So now I'd like to introduce Professor Gabrielle Casper. She is the president of the International Health Awareness Network, head of the Clinical Discipline Obstetrics and Gynecology Sydney campus at the National School of Medicine and the University of Notre Dame in Australia. And she has undertaken projects with the World Health Organization and United Nations and cares for her patients with compassion and understanding, while lobbying to improve women's health in Australia and overseas. I'd like to hand it over to Gabrielle.
Thank you very much. I'd like to thank Elaine Congress, Sandy Turner, and the organising committee for inviting us to take part in this wonderful Congress. I'd also like to thank Suresh Roshan for facilitating the long-term relationship between Fordham and IHAN. Lynn Madden and Megan Bredden have also assisted in helping the students prepare for today. All the students have their final year university exams on Monday, and some are doing trial exams. May I ask the students to unmute and say your name so we can see your faces?
Hi, so I'm Priyanka Pinto. Hi, I'm Emily Cody.
Hi, I'm Isabella.
I am Indigo Kite.
Thank you very much. The title of our segment is Telehealth in Australia. Women and girls are facing many health challenges across the globe, and technology is greatly assisting us with this battle. The first speakers will set the scene and introduce the power of podcasts. Then we will give examples of technology working well to improve women's health. Let us begin with the talk with Laura and Emily.
Hi, I'm Emily Cody.
And I'm Lara McDonald.
And we're third-year medical students from the University of Notre Dame, Australia. Today we're talking about rural health in Australia, trends for women, and the emerging threats to health. 28% of the Australian population live in rural and remote areas. And these Australians unfortunately have shorter lives, high levels of disease and injury, and poorer access to and use of health services. And this is especially true for women in these areas. The total burden of disease and injury increases with increasing remoteness, and people living in rural and remote areas face significant barriers to accessing healthcare. There are also higher proportions of Indigenous Australians in rural and remote populations who are themselves a vulnerable population and have poorer health outcomes. Climate change is an emerging threat to health and affects the social and environmental determinants of health. It does this via a range of different pathways, from increasing the frequency of extreme weather events to increasing prevalence of infectious and communicable diseases, even to the availability of food and water. Between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year. Climate change affects some population groups more than others, notably those already experiencing disadvantage, including women and their children, those living in rural and remote communities, and Indigenous populations. Women are more vulnerable to the impacts of climate change, and globally, extreme weather events kill more women than men.
There are also rural-specific effects of climate change, and these include extreme heat, severe droughts and floods, and bushfires. These three factors lead to economic challenges on rural communities who are heavily reliant on agriculture and farming. It also leads to a loss of traditional fishing and hunting grounds for some Aboriginal and Torres Strait Islander communities, as well as the attrition of the rural medical workforce, 30% of which are predicted to leave due to unbearable climate in rural areas. Fourthly, it results in a scarcity of medical supplies, including renal dialysis, which is a water-intensive process and is scarce in times of drought. All four of these factors lead to poorer mental and physical health outcomes for rural populations. There are plans in place to address the climate effects on rural communities. First is applying rural proofing to climate policy, which is essentially a rural voice on climate policy. The second is investing in programs and initiatives that promote preparedness for climate change, and this includes livestock grazing beneath wind turbines and sugar cane fields to produce bioethanol. Thirdly is the establishment of the National Sustainable Development Unit to ensure that rural communities can transition effectively to meet the challenges of climate change. Importantly, the majority of the rural population is on board with these strategies to act on climate change. Finally, Emily and I have a podcast called In This Climate, where we discuss the effects of climate change on health, particularly rurally. Podcast listening has been proven to increase knowledge retention in medical students. Podcasting provides education and upskilling to any rural community with internet and a mobile device. Our podcast is streamed all over Australia and the world, reaching communities and educating them about the effects of climate change on health. And these are our references. Thank you.
Hello and welcome to our talk on technology supporting public health. My name is Tessa Hunt.
And I'm Constance Maliaris. The World Health Organization defines health technology as the application of organized knowledge and skills in the form of medicines, vaccines, medical devices, and procedures, alongside systems that are used to solve numerous health problems and improve the quality of life across the world.
Technologies are revolutionizing every stage of the patient care pathway. Diagnosis is more sensitive and occurring earlier than before with the use of biosensors and artificial intelligence. Manufacturing processes such as 3D printers are improving the quality and availability of therapeutic devices and pharmaceuticals. Robotics are facilitating the safe application of precise surgery and targeted drug delivery. Drones are being used as a solution to logistical barriers to deliver medical aid to isolated or dangerous geographical locations. Patient support and autonomy is evolving with networking technologies such as the Internet of Things, which enables data sharing and communication abilities. These innovations are making healthcare more accessible while also alleviating the strain on human resources and hospital capacities.
The importance of digital technology in healthcare was highlighted by the COVID-19 pandemic. We saw sharing of epidemiological modeling and viral genomes facilitate the rapid development of vaccines, including the new mRNA method, pushing research beyond its previous limits. From a public health perspective, we saw the introduction of digital contact tracing and QR code scanning assist epidemiological advancement. We also saw the pandemic force the rapid development of telemedicine services, which, although imperfect, are now established and relied upon in rural health services within Australia.
Despite offering enormous promise and potential, the implementation of technology in healthcare is met with many challenges. These vary for different stakeholders, each of which is driven by different incentives. Some of these challenges include data security and protection, integrating with existing healthcare structures, cost, patient equity, differences in medical standards, and insufficient evidence. We are currently at a pivotal point, which provides us with a unique opportunity to act proactively rather than reactively in addressing inequalities for low and middle income countries.
Whose response to this is summarized in the Global Strategy on Digital Health, outlining technology as something that should be an integral part of health priorities and benefit people in a way that is ethical, safe, secure, reliable, equitable, and sustainable. The strategy follows 4 guiding principles. These emphasize the need to address inequity in healthcare by further exploration and innovation of global solutions and shared services. Thank you for listening.
Hello, my name is Priyanka Pinto, and this is Sharon Yap. We're medical students from the University of Notre Dame, and today we're going to be presenting about the growth of telehealth in Australia. So a brief overview of telehealth. As many of you know, telehealth allows you to consult a healthcare provider on an audio or video call. It was expanded in March of 2020 to ensure the safety of patients and healthcare providers during the COVID-19 pandemic. And now many of these services have been retained permanently. Telehealth involves consulting your healthcare provider remotely when they have determined a physical examination isn't needed and you aren't able to see them in person. Telehealth services can include a diagnosis, treatment, and prevention. So telehealth consultations are not only convenient, they also ensure the safety of others by reducing the spread of illness. And this was very relevant during the COVID-19 pandemic when we were required to self-isolate or quarantine. And you can also, on telehealth, consult a medical specialist, allied health professional, nurse, midwife, or nurse practitioner via telehealth instead of face-to-face if appropriate. Between March 2020 and March 2022, over 100 million telehealth services were delivered to around 17 million Australians across the country. More than 92,000 medical practitioners have now used telehealth services to support their patients. And of these services, to break it down, GPs have provided almost 83 million, specialists almost 11 million, and allied health professionals around 5 million services.
Yep, so although telehealth has been around for a long time in Australia, the uptake has been limited and is mostly used in the rural and remote communities. COVID-19 and recent changes to Medicare items for telehealth have boosted its use in recent years. During the COVID-19 pandemic, the Digital Health Cooperative Research Centre, DHCRC, responded quickly to support the health community, and they developed the Telehealth Hub, which collects resources to help patients, clinicians, and policymakers, and to support the delivery of high-quality, safe, and compassionate healthcare. They also launched a series of telehealth webinars featuring leading experts and practitioners who shared their knowledge with thousands of attendees. So this is what the Telehealth Hub looks like, and that's the link. They provide resources on technology for patients, clinicians, as well as COVID-19 resources as well. So to conclude, telehealth has grown significantly in Australia since the start of COVID-19 pandemic, and it has played a crucial role in improving health outcome of Australians by improving their access to healthcare services, especially during the pandemic lockdown. Telehealth is expected to continue as an ongoing and permanent feature of the Australian healthcare system. Thank you.
Good morning, my name is Isabella Tan and I'm a second-year commerce student.
My name is Indigo Kite and I'm a second-year genetics student.
And my name is Charlotte Tan and I am a high school student in Year 12.
Today, we will be exploring what emergency telehealth is and why it is essential for remote residents, particularly for women living in Australia.
Telehealth has revolutionised how regional patients receive healthcare, but did you know that it has also influenced the administration of acute emergency healthcare in these same communities? My Emergency Doctor is an organisation that utilises telehealth to deliver 24/7 healthcare and senior emergency doctors to regional patients. Patients now have direct access to emergency doctors when they need urgent but non-life-threatening medical care and are unsure if an ambulance is required. These services can connect an emergency specialist doctor via telehealth to assess the patient and provide support, removing the need to travel long distance to the nearest hospital. This service decreases patient flow into already crowded and understaffed regional hospitals, reducing patient transfers to external hospitals and alleviating some pressure on staff members. In addition to this, acute medical conditions can be escalated past a telehealth consultation, providing in-person assistance in critical scenarios, thereby sending the greatest resources to places with the highest need for medical help.
Telehealth operates as a medical tool essential to women residing in remote and rural areas, equipping individuals with online communication and healthcare consultations. In Australia, 51% of the rural adult population are females, often susceptible to infection and disease and unable to seek medical attention. Therefore, telehealth eradicates the restrictions of a conventional face-to-face encounter, diminishing locational and time-imposed boundaries essential to remote women's health. Australians in rural areas experience overall health inequalities due to inaccessibility. For example, those residing in major cities were 9.2% more likely to seek dental health than those in outer regional, remote, or very remote areas, 3.4% more likely to visit a medical specialist, and 2.9% more likely to see an after-hours GP. However, women also experience childbirth, with remote Australia severely lacking childcare. Telehealth is crucial to provide these women with additional access to medical facilities.
However, there is much more that needs to be done. 1/3 of Australia's women live in rural, regional, and remote areas, and their needs and conditions are vastly different from those living in metropolitan areas. This is mainly due to socioeconomic conditions coupled with challenges in healthcare accessibility. Whilst telehealth has made an important stride in bridging the gap between rural and urban medicine, there remains a general pattern of poorer survival rates in rural areas, and telehealth will not make up for the crucial emergency services such as ambulance and physicians needed in times of crises. With rural populations in Australia expected to increase 1.4% in 2024, it is more crucial than ever to make telehealth and greater rural emergency access a government priority. Steps to bridging this gap include making telehealth permanent, increasing government funding, and incentives for doctors to move rurally. There is still much to be done regarding telehealth, for example, educating the broader population as to what classifies urgent versus non-urgent symptoms to increase productivity of our medical workers.
However, it is undoubtedly true that telehealth has helped bridge the gap between remote and urban emergency medical accessibility and has become an essential part of our healthcare system.
Thank you for listening, and we are happy to take questions.
Oh, thank you very much to all of Gabrielle's and your students on this really interesting presentation on rural health and telehealth and what's being done currently. I think we have time right now for one question, but we'll have time for more at the end. Is there anybody who would like to ask a question to any of Dr. Casper's students? Okay, well, you can also put it in the chat if you have a question, or you can also think about, and we'll come back again and we'll have more questions at the end of our conference. Okay, thank you. So moving along.
Daniel?
Digital advances create a worldwide dilemma. How can we make the maximum advantage of the new technology in a way that assures it will reduce existing disparities? Maddie Hines is the head of the digital strategies effort at the Montgomery County Public Library. Public libraries are key because they are accessible to everybody and they have resources that people need. She has spent the last decade leading digital transformation within the state of Maryland in public libraries and schools. Her work focuses on bridging the digital divide within local communities through innovation, technology implementation, and digital literacy. Today, she's going to talk about the advances made in using digital resources to overcome the challenges facing libraries, and she will give as an example the response that the libraries had to the COVID-19 pandemic.
Well, thanks, Dan, and thank you for inviting me. I'm going to go ahead and share my screen really quick. Okay. All right, so tonight I'm going to be discussing the pivotal role that public libraries play in bridging the digital divide. According to the National Digital Inclusion Alliance, the digital divide is the gap between those who have affordable access, skills, and support to effectively engage online and those who do not. I think it's important that we define what the digital divide is so we can really address it in a comprehensive and strategic way. My library system is a suburb north of DC and serves about 1 million residents, spanning high-density urban centers to agricultural farm communities. Even though we have some of the most affluent zip codes in the country, we also serve populations who can be digitally disenfranchised. Public libraries play a vital role in addressing challenges ranging from lack of high-speed internet to digital illiteracy by providing our communities with access to devices and infrastructure, direct training and support for digital literacy and technology, and also physical spaces for digital content creation. And many public library systems have codified this commitment to bridging the digital divide by folding this work into their strategic plans. Within our strategic plan, this is one of our essential goals for the next 5 years, to help those who are facing a digital challenge increase their skills and abilities in order to thrive in an increasingly digital world. But I want to go into specifics about what public libraries do in general, and then I'll connect that to a real example of one of our customers' experiences as they faced some challenges during the COVID-19 pandemic, which I've heard a lot of people mention today. Okay, so access. We're going to start here. Our agenda today is we're going to talk about access, education, and services within public libraries. So starting with access. Public libraries provide access in general. Most public library systems not only have hardwired public computers, but also lend laptops and other devices. My library lends tablets with preloaded digital content for kids as well. And some other library systems loan iPads or Android devices. If you're curious to see what your public library loans, just go to their website and search for devices or downloadables. For internet access, we provide free Wi-Fi within our buildings, but also since COVID, we have expanded to our parking lots and outdoor areas. And if you need access to the internet at home, you can check out a Wi-Fi hotspot from our catalog. These are incredibly popular and remain in constant circulation in our system. Our outreach team actually uses our hotspots to engage communities who lack stable internet and broadband as well. So speaking of broadband, many public library systems partner with local and federal government to expand broadband access. Maryland has a broadband initiative originally started by public libraries. It's called the Sailor Network. So we were really on the forefront of broadband expansion and recognizing broadband as a utility. And then regarding access to information, public libraries often have robust digital collections spanning not just ebooks and audiobooks, but streaming movies, music, and free subscriptions. Often these subscriptions are heavily paywalled, but incredibly relevant, such as the Washington Post or the New York Times. These subscriptions can cost a lot of money, and so us being able to provide those free to our community online digitally connects our customers to the digital world. We also provide free digital access to learning resources like LinkedIn Learning, Udemy, Rosetta Stone, and a myriad of other online learning platforms that would typically cost hundreds of dollars in subscription fees. And these digital services, these learning platforms often provide our customers with pathways to certified and credentialed training. So, you know, with access, we need to have education. We cannot just provide access to something. We need to provide our customers with the skills and abilities to use those things. So public libraries not only provide all of the above, but ensure our customers can navigate these resources in a way that is meaningful to them. In order to do that, we also provide digital literacy and technology training to our customers, both online and in person. Through partnerships like Senior Planet, which targets older adults, we provide training on everything from how to use a computer keyboard to navigating and participating in social media, which comes in handy when our older adults are trying to stay connected with their families and friends. Another example, our North Star Digital Literacy Program is virtual, self-paced. It's a learning environment that teaches the fundamentals of technology and digital literacy, starting all the way from the very basics of what is a computer mouse to more advanced learning like building an HTML website. And that program is for all ages. You can even earn a high school diploma through virtual classes at the library with our Career Online High School partnership. This means that a customer who works a challenging schedule can log into our website on their own time and earn their GED, opening up a window of immense opportunity for them. Now let's talk about services. So we have many in-branch services related to digital literacy, technology, media creation, etc. Our libraries are trained to provide on-the-spot support for customers. We help customers fill out digital forms, print out documents, navigate online social services, apply for benefits online, and connect with their families virtually. I've personally assisted a customer, actually many customers, in setting up Zoom accounts and learning how to use those platforms so they could talk with their families and friends while we were all isolated during COVID. We also have a myriad of physical spaces designed around providing access and training to digital skills. We have digital media labs for content creation. These labs are outfitted oftentimes with very expensive hardware and software and tools that most people wouldn't normally have access to in their homes. I've worked in libraries that have had fully built recording studios with a computer outfitted with Pro Tools, so customers could record music, podcasts, or any other audio media. In a neighboring system that I used to work at, a hip hop group, a local rap group, recorded and produced demos to upload on SoundCloud, which is a music sharing platform for artists all over the world. All of the music studios were at the local library, and again, this was all free. The same is for makerspaces. Most public libraries have a makerspace these days for customers to use expensive tech equipment. Things like 3D printers, or often will host tech events like hackathons or coding clubs in these spaces. So these spaces often do not exist anywhere in the community and are hubs for tech exploration and training. Finally, I want to tie this together with a real-life case study of one of our library customers during COVID-19. And this is just one case study of many, many. When schools closed and everything pivoted virtual, libraries were essential in assisting customers like Nancy. I'm going to call this person Nancy. That's not their real name. In helping them navigate this digital divide. Nancy is a mom of 2. She's an essential worker and she lives in an apartment complex. Nancy faced a few challenges. She had 2 kids who needed computers for online learning during the COVID-19 shutdown. And her apartment complex was now overtaxed with internet users, making the Wi-Fi slow and glitchy. So her children couldn't take classes at the same time and participate in virtual learning because the internet access was not very good. She also needed true and valid up-to-date information on COVID and COVID resources within our community, such as test kits and policies and what our community response plan was. And the library website hosted this information and updated it in real time. And she was able to call us and we would assist her in navigating everything from where to pick up test kits to how to access virtual portals online. And so our digital infrastructure within the website really provided her with that critical, real information. We're a trusted source of information. So as in our library system, we were closed to the public at first. But we were also able to provide her children with expanded Wi-Fi in our parking lots and outdoor spaces. So she actually drove up to our library and her children attended class in our library using our Wi-Fi in the parking lot of our library. And this was before we had sort of figured out a better solution to that, but that was really essential in the first couple of weeks of the pandemic closing. Our librarians were also able to assist her virtually in finding programs for free computers because their family only had 1 computer and they needed another one for her to be able to allow her children to both attend school at the same time. Once restrictions loosened, she was able to check out hotspots. So those Wi-Fi hotspots that I mentioned earlier. for an even more secure wireless connection that her kids were able to use in their own apartment instead of having to come to the physical branch to use our Wi-Fi. And I cannot stress this enough. Our librarians in the branches and our virtual reference librarians were really an essential component of providing our customers with valid and trusted information during the COVID-19 pandemic. If you all remember, those first few months were just filled with misinformation. And so the public library is a trusted source. It's a trusted institution that our patrons can seek out when trying to seek clarity in times of crisis. So to wrap it up, public libraries are essential to closing the digital divide through access to technology and information, tech and digital education, and one-on-one support services in navigating an increasingly complex digital world. So that's all I have for tonight. If you have any questions, go ahead and put them in the chat. And thank you for having me again.
Thank you so much, Maddie. I'm always amazed at the wealth of services that public libraries in this country provide and continue to increase all the time, as far as I'm aware. Does anyone have a question for Maddie?
I don't know if it's so much a question, but I'm just very impressed by services you provide for homeless people. They can't, stay, in the shelters during the day. And, and so they frequently go to libraries, and, there's all kinds of educational resources for them. And it's really made a difference in their life.
That's true.
Well, thank you again. Okay, thank you, Maddie. Okay, now I'm pleased to introduce Dr. FIWG Melnick, who will be discussing success in closing success in closing any digital divide in the state of Kerala in India. It's an amazing success story. Dr. Melnick is Professor Emerita of Biological Sciences at the University of the District of Columbia. She was also an Associate Director of the International Center for Interdisciplinary Studies in Immunology at Georgetown University Medical Center. She served as Special Assistant for Policy and Bioethics to the Director of the National Institute on Aging and Health. She's also served as the Principal Investigator on several research projects on women and children's health. She's the recipient of the International Peace Scholarship Award, and she's listed in several Who's Who's publications. This is only a partial list of her many accomplishments. She's currently the co-president of IHAN, and our Institute for Women and Girls at Fordham is very honored to have worked with her, collaborated with her for several years on our conferences. So, Dr. Melnick.
Kerala is a small southern state on the west coast of India, occupying less than 2% of the Indian landmass. It is a very diverse and beautiful country with a rich history of welcoming people from various cultures and religions. At the turn of the 20th century, Kerala had a very stratified society. Post-independence, the state moved to promote social and economic equality, along with enhanced educational opportunities. These efforts resulted in Kerala becoming one of the most progressive and developed states in India. Kerala is popularly known as God's own country, not just because it is green, scenic, and picturesque place, but also because it boasts a high quality of life and reports the highest Indian literacy rate of 96%. The reformers drew upon social structures that date back several centuries. Many Kerala women had long enjoyed equality with men. Kerala's strong commitment to education and human development over the decades sustained and improved its high literacy rate. Successive governments have held fast to this commitment. At the time of independence, Kerala was one of the poorest states in India, yet it had the highest literacy rate of about 47%. Today, its people are among the most economically advantaged according to Multidimensional Poverty Index, based on indicators such as nutrition, years of schooling, child and adolescent mortality, maternal health, and others. Kerala accomplished this not by attracting large industries, but by systematically implementing policies that include land reform, universal and compulsory school education, democratic decentralization process, and healthcare initiatives that played a significant role in uplifting marginalized sections of society. Kerala enjoys little or no school dropouts. All this contributed to its high Human Development Index and quality of life. Currently, Kerala has the highest Human Development Index in India, measured in terms of its high literacy rate and school enrollment, its dramatic reductions in fertility, its relatively long life expectancy, and its female to male ratio, which is indicative of the greater gender equity in the region. In 2022, Kerala reported a GDP growth rate of 12.1%, compared to 8.7% for all of India. Yet, when the internet and computers were introduced to the state, there was a danger that this might lead to disparities between the haves and the have-nots. Due to a series of interventions, Kerala developed statewide information and communication technology, ICT, that engaged the general population. This was no accident. Over the last 2 decades, the Kerala government and its leaders decided to use information technology to spur economic and social growth. The state government, recognizing the role of education, science, knowledge, and information in driving economic growth and development, designed an IT policy to stimulate the advancement of this sector. In a paper, Kerala's Changing Technological Environment, ICT Diffusion over 20 years, Miller and others commented that Kerala model, with its high literacy rates and investment in education, places it in a unique position to take advantage of the new information technology to promote social and economic growth. Success depended on addressing the digital divide to assure that no part of the population was left out. Accordingly, the state government made significant investments not only in the necessary infrastructure, but also in promoting a technologically trained and educated citizenry. It is often thought that economically advanced countries have an ICT advantage over less advanced countries. As well, there may be wide differences within countries, depending on divisions based on urban versus rural, race, gender, economic development, etc. Kerala was one of the first states in India to develop a policy designed to promote and accelerate diffusion and use of ICTs. Kerala IT policy was first drafted in 1998. It went through many revisions, resulting in a final draft in 2011 that had as its goal of establishing Kerala as a leading IT destination, enhancing employment creation in the IT sector, and transforming Kerala into a knowledge society. Under this plan, the Kerala Department of General Education established the IT at School program, ensuring that all schools have internet-enabled computer access. It targets over 12,000 schools and 6 million students for broadband internet connectivity and infrastructure upgrade. In 2020, Kerala became the first state in India to go fully digital in public education. The state also implemented the FRIENDS system, FRIENDS standing for Fast, Reliable, Instant, Efficient Network for Disbursement of Services, which makes it easier for citizens to engage in government transactions such as paying utility and telephone bills and taxes. The state's Kudumbasri, Prosperity of the Family program, aims at eradicating poverty and empowering disadvantaged women by promoting entrepreneurial activities and dynamic leadership. It is achieved through organized community network. Today, it celebrates its 25th anniversary and reports a resounding success by showing a significant rise of women in legislative bodies, white-collar workforce, agricultural projects, and micro enterprises. Women selected for the program receive training that includes a focus on eliminating digital gender disparities among the least advantaged women. An important factor facilitating these advances is the decision to ensure coverage of ICT in all parts of the state. Even though there are large cities, Kerala does not have the extreme urban-rural contrast found in other parts of India. Nevertheless, the Kerala government established a special program designed to provide ICT access to rural areas. The program ensures that users have both the skills to use the technology and have access to information relevant to their lives. It aims to establish computer access within 2 kilometers of the homes of rural residents and to provide technology training to them. To achieve ICT equity, Kerala has designed a hub and spoke model in which select cities will act as hubs and the remaining districts will be the spokes. This ensures the development of the districts within the spokes. The hubs are supported by information technology centers designed to serve as innovation generators, such as the establishment of Technopark, Infopark, and Cyberpark. The results of these efforts are impressive. Impressive, for example, while 3% of the Indian population lives in Kerala, it has 15% of the mobile phone connections in India. Men and women have approximately equal access to the internet, email, and personal computers, and both identify as active users of the technology. By 2005, any existing gender disparities in access had disappeared. The Kerala goal is total literacy will soon achieve total connectivity. Thus, globally, it is indeed in a very special place. ICT has had a direct impact on the delivery of government services. The Kerala response to COVID illustrates the advantage of information technology, which is widely distributed and has overcome digital divide. For example, during the period of January 2020 and November 2020, Kerala reported 500,000 confirmed cases of COVID-19 and case fatality rate of 0.4%, one of the lowest in India and perhaps the world. For the same period, India reported 1.5%, United States 2.4%, and China 5.2%. Kerala's multi-sectoral response that included widespread testing, treatment and containment, use of quarantine centers, designated hospitals, and social protection, including distribution of food and essential supplies, no doubt accounted for its low case fatality rate. All this was helped by the fact, as India's first digital state, Kerala has the highest percentage of households with computers and the internet. It has 95% of mobile phone penetration and over 75% of digital literacy. At the time of COVID-19, Kerala's experience showcased the diverse and innovative ways that digital tools could build on a strong underlying health system to support pandemic response across the domain of communication, surveillance, clinical management, non-clinical support, and core health system readiness. Connecting the dots, Kerala's use of digital technology during the COVID-19 response is a paper that was published in the British Medical Journal global health. The authors of that paper note that digital tools in Kerala was able to proliferate rapidly and help meet diverse citizen needs due to high level of collaboration and intersectoral response that brought together different levels of government, several state departments, the private sector, the energy of civil society organizations, and community volunteers. The Kerala government executed the ICT initiative in a way that bolstered the citizens' participation and consequently resulted in high levels of compliance. It made sure that the digital technologies offered benefits that are tangible and concrete other than esoteric and diffuse. In January 2023, Kerala inaugurated its own internet called KFON, Kerala Fiber Optic Network, the only state to do so, bridging the digital divide and making internet access a basic right. It provides affordable and better broadband connectivity to households. It assured free access to 2 million poor households, coupled with skills training to use the internet. It facilitated remote education and healthcare access. It is expected to boost economic growth by providing digital infrastructure, supporting local enterprises. Kerala offers important lessons that can be emulated by other states in India, as well as nations across the world. It demonstrates what is important is the dedication of governments, a solid educational foundation, and a policy of equity and distributive justice that fosters a progressive and developed state or nation. Thank you.
Oh, what a place. I wish we could all, we all have a lot to learn from Kerala. It's amazing that this small state has accomplished so much.
Yeah, I was amazed myself. I have to say that I'm very proud to admit that by birth, I am a resident of Kerala.
Well, I can understand why you'd be very proud to admit that. I think it sounds like an extraordinary state. Does anybody have a question for Dr. Melnick?
I don't know. Does anyone have a question? I mean, I just am so impressed. How did this government get so behind really pushing digital, literacy for all?
It is really amazing. And what is amazing is that governments changed. You have elections periodically. Mm-hmm. So governments have changed from the Democratic Front government and then the Congress government. Various parties were in charge at various times. But all through that, all governments decided to stick with this problem or the issue of both education as well as the digital competence.
I have a question for Melnick, if I may.
Right.
It sounds incredible, and it's very specifically to Kerala. How is that going to be expanded, or is it going to be expanded across all of India and indeed everywhere else?
Well, it's not easy. I mean, first of all, education is the main key. To have the citizens educated so that other information can be provided is one of the key reasons. But also, Kerala has had women empowered for a very long time. Most of the women in society are empowered, and they have equal rights and equal role in society. So that was, when I came to Wisconsin, for example, when they talked to me about, that there should be rights for women, I was amazed. I said, why are you talking about rights for women? I mean, isn't that the usual case?
Yeah.
And I learned that there was much to be learned, much to be understood.
Really?
Thank you.
Thank you so much.
Okay. Next, we have So Pat Brunel is going to be introducing Kristen. Pat.
Hello, everyone. I'm so pleased to introduce our next speaker, Kristen Treglia. Kristen is Senior Instructional Technologist with Fordham IT and a valued member of the Fordham Institute for Women and Girls. She has a wealth of knowledge and experience in the realm of education technology, offering unparalleled support, expert guidance, and cutting-edge training. Her areas of expertise include faculty development, online learning, digital citizenship, and emerging technologies. Kristen?
Thank you, Pat, for that great introduction. Let me just share my screen. Okay. So I'm very excited to be with you all to share some of the things that are happening in healthcare innovation today. Before we get started, I just want to mention that I'll share a link to my website at the end where you'll find the slides and then a resource that I've prepared with you with other articles of interest, along with a link to the magazine I created that goes along with this topic. So it's a free account to read it. You don't have to sign up, but if you do, it's a little bit more fun. You can do things like save your own articles. So my aim today is to give you a good explanation of what these technologies are, some different examples and possibilities, and then again, share those resources so that if you're interested in learning more, you have a place to get started. Data visualization can help to simplify complex health data to present it in a visually appealing way. So that will help people make more informed decisions. And with the tools available today, you don't need to be or need to hire a graphic designer to be able to make an effective infographic. And in today's world, this is becoming even more and more important because we are all generating a lot of data, but in particular, the healthcare industry generates a ton. So it can really help to make sense of all of that data. So by presenting it through visually appealing graphics, you can easily compare and comprehend the information, which in turn will help inform decision making. When you create one, some of the things to consider are these 10 overarching principles that will help to promote equity, accuracy, and inclusivity. So I highly recommend anybody that's starting out to create their own infographic to check out this report if you're only going to look at one resource. And if you're only going to check out one tool, that tool I would recommend is Canva. It's extremely easy to use. You can get a free account. The free templates are wonderful. But if you want to look more in depth on this topic, I have additional resources as well. So 3D printing. Most people are familiar with how 3D printing now, it's been around for a little bit. I do want to point out that there are lots of different ways that materials can be printed, and there are a lot of different types of materials that can be used to print. So usually we think of 3D printing it as plastics, but 3D printing can do a lot more than that. The market size for 3D printing today is in the billions. So it's a very important technology, and there are lots of different ways that you can see it used in the healthcare industry. I'm going to focus in on one example in particular. So prosthetic devices help patients get around more easily. However, they are very expensive. And this is especially true for children with limb loss. And the reason for that is they outgrow them very quickly and they require frequently replacements. So it costs on the average of $80,000 US per limb to keep a child outfitted with the appropriate prosthetic. There is an organization called Enable, which is an online global community volunteers from all over that use their 3D printers to make free and low cost prosthetics for children and also adults in need. They're created from open source designs, and they help those in underserved communities who have little to no access to the medical care they need. They're always looking for more volunteers, so if this is something that interests you, you can get involved by checking out their website. In addition to the flipboard that I made on the general topic, I also have a specific one that I've been flipping for years now on 3D printing. So you can check that out as well. Extended technologies. So these include things like virtual reality, augmented reality, and mixed reality. Can immerse users in an interactive simulation and educational experience. So it can not only help patients clinically, but it can also bridge the gaps in access by providing an in-house option. So that's an umbrella term, right, to incorporate AR, MR, and VR. You can see examples of what that would look like here. Most of us have heard these terms before, but you might not have heard extended reality to group them all together. One of the ways, I'm going to start with virtual reality, can be used is to give people the opportunity to confront their trauma and fears in a controlled environment guided by a therapist. So, for example, the advantage of using VR therapy for treating PTSD lies in its ability to create controlled, immersive environments that simulate those triggering situations. That allows individuals to confront and process those memories in a therapeutic setting that leads to desensitization and symptom relief. An example of how augmented reality is being used, for this one, I picked an example where you can see vascular access is actually one of the most common invasive medical procedures, and it's foundational to many of the diagnostic and clinical procedures. But about 40% of the IVs miss the vein on the first stick, and that number gets worse for children and elderly. So by using an augmented reality a handheld scanner that projects over the skin, the nurses and doctors can see exactly where those veins are. This medical startup called AccuVein estimates it's been used on more than 10 million patients, and it helps to make that first stick 3.5 times more likely. Again, I have lots more examples that you can look at. We don't have a lot of time here, so I just picked a couple for you. And yes, I also have a magazine specifically on this topic. So I had to talk about artificial intelligence because this is the year for it. We've been seeing articles all over the news about it. But I wanted to just make sure that everybody understands what those terms that you hear actually mean. So AI is referring to the development of computer systems that can perform tasks that typically require human intelligence. So this is such as learning, problem solving, and decision making. Machine learning, which you probably have also heard of, is one subfield of artificial intelligence. So that refers to the process of using mathematical models of data to help a computer learn without direct instruction. And predictive analysis uses machine learning and AI as tools to parse data and predict possible outcomes. So they can analyze vast amounts of health data to provide personalized recommendations, predict health outcomes, and assist with diagnoses and treatments. There are so many ways that it's being used, even as we speak, to improve service quality, patient outcomes, reduce costs. I mean, there's really a lot we could talk about. But what I wanted to focus on was one of the concerns that we have with AI technology, and that's that the algorithms and models used in these systems inadvertently reflect or perpetuate the human biases present present in training data. So this can lead to discriminatory outcomes or reinforce existing societal prejudices, emphasizing there's real need for addressing these biases in AI development to make sure that there's fair and equitable results. And one of the programs that I found that is doing a lot to address this lack of diversity in data is the All of Us program from the National Institute of Health. Their goal is to reach more than 1 million people from all backgrounds. And you can see from their timeline on the chart, they're actually doing really well. Did I get the number? Nope, you can check the website to see the current number. But if you're interested, go to their website, sign up to be a volunteer and share that with your friends. I don't have a flipboard on AI, but I am part of the Fordham's faculty interest group on AI. And so I've organized a website that has lots of resources and information if you want to check that out, in addition to the articles that I've pulled for you. Finally, I'm going to go through this one really quickly because I think I'm already over time. Blockchain. So this is probably one of the most mysterious ones, but it is an important technology. So, you know, in plain English, if you think of blockchain like a shared digital recipe book at a potluck, each guest or computer has a copy. And when someone adds a new recipe or transaction, it gets written down in a special way. And all of those recipes or transactions are connected like a chain because everybody has the same book and can check the same entry. It's tough for somebody to sneak in a fake recipe or change what's already written, making that data more reliable and trustworthy. It's still a relatively new technology. However, you can see has a large market share, and it's projected to grow immensely within the next 5 years. Some examples of ways that blockchain can be used in healthcare. Most of it focuses on records, research data. I'm going to share a real world example, well, not an example, a case study. The developing world faces 2 critical challenges in particular with regards to data. And so if you look at this example, it's really highlighting the there are 5 different data sets in different silos, different organizations. And so the problem is she has no leverage, no history, no economic profile summary, no credit-worthy baseline. And so a proposed solution to leveraging this technology is to create an economic identity that's owned by that individual. And so they establish a distributed ledger that includes all of the critical life elements such as land ownership, health industry, crop information, and by recognizing and implementing these interoperability protocols for sharing the information among development agencies, this can help mitigate the issue that you see with sharing data. I want to wrap up with 2 thoughts. First of all, none of today's technology advancements are happening in a bubble. As they mature and converge, they create even more possibilities. And here's a look at, I know it's kind of small, but when you look at it on your own screen, hopefully it's a little bigger, of the current and possible trends that we didn't get to look at today. And so when I see this graphic, to me, it's even more apparent and imperative that we are, as allies and advocates for the marginalized and disadvantaged, so that we have a more equitable society. So anything that you can do is good. right? Always think of it that way. You can't solve the whole problem, but you can do your part. So I hope that the information that I've shared with you today provides you with some ideas and possibilities of the technology. And if you want to take a look, at those slides, they have a lot more information on them and the resources that I've linked to. You can find them on my website, and I'll put them in the chat for you as well. So,
wow. Thank you, Kristen. You really expanded it. What a comprehensive definition of AI. Thank you so much.
No problem.
Does anybody have a question before we move on? We can also we're going to come back at the end too for more questions. Okay, now I'm really pleased to introduce Edward Ruhr, who is from South Africa, and he is a member of IHAN. He has a wealth of experience in the fashion and film industries. The heart of his passion lies with the women of the Golden Thread, which we will soon hear more about. It is an innovative initiative aimed at bridging the digital divide for women in Africa. This is a mobile app that empowers women with access to essential information and provides them a safe space for connection and support. Edward envisions a world where women are empowered using technology as a catalyst for progress and change, which I share that dream. I'm pleased to introduce Edward Ruhr.
Well, here we go.
Hi, everybody, and welcome to Women of the Golden Thread. Women of the Golden Thread is a comprehensive platform to support women in Africa who has experienced gender-based violence. But before we introduce you to the app, a bit more about me. My name is Edward Ruhr, and I'm from South Africa. My background is in fashion and film, but I've decided to change my discipline to UX design 2 years ago. I was fortunate to be part of a project called Bride Armor that focused on domestic violence in South Africa. Working on this project, Bride Armor, was a great success and gave the cause a lot of exposure. This made us think about how we can help women who are suffering from gender-based violence in Africa using another platform to communicate the essence of gender-based violence and give women a voice and a different way to access help they so desperately need. Herewith is a reference to the project that illustrates how we represented the strength of women fighting domestic violence in a different narrative. Doing research on gender-based violence, we found that the information about this topic was well highlighted in the representative countries, but not in one library where all the information can be accessed. Scattered all over the web and not easy to find. Within this research, we also found that there are limited ways in which women in Africa that suffer from gender-based violence can communicate and get a link to some direct help. This inspired the concept of Women of the Golden Thread. Women of the Golden Thread will be a comprehensive platform that will provide resources and support to women who have experienced violence. This app will feature a variety of tools and features that will include a profile page where users will be able to create a profile, add their contact information, and share their stories. A statistics section that will provide an up-to-date information and articles about violence against women in Africa. A billboard where users will be able to post events, fundraisers, and projects related to violence against women. An emergency link that will provide users with access to helplines and other resources in their country. A directory of NGO charities and safe houses in each country. A marketplace where women will be able to sell their handmade products. And a blog where women will be able to share their stories and experiences and find resources and information about violence against women in Africa. We believe Women of the Golden Thread is a groundbreaking initiative that will make a real difference in the lives of women who have experienced violence in Africa. It aims to provide a safe and supportive space for women to connect with each other, share their stories, and get the help they need. The Women of the Golden Thread project goes beyond the digital realm to encompass a tangible representation of its message. First, in a life-size dress sculpture. This sculpture, crafted from a vibrant array of African fabrics, accentuated with a cage-like structure incorporated with golden metal threads. This dress sculpture will exalt the resilience and strength of women who have overcome gender-based violence. The sculptural dress will then be filmed and captured in a short film format centering around the story of Women of the Golden Thread. The visual narrative can be used to promote and encapsulate the essence of this important narrative. To further amplify the impact of the Women of the Golden Thread project, the sculpture dress will be transformed into a QR code that can be used at any activations in all its various formats. It also symbolizes the power of technology to bridge the digital divide and empower women even in the most remote community. The sculpture and QR code can also travel and be projected in public spaces, ensuring its accessibility to a wide audience, serving as a beacon of hope and a symbol of the collective power of women to break the silence surrounding gender-based violence. Sustainable development is a crucial aspect of this project, aiming to achieve this by registering helplines numbers and creating QR codes that directly link to these helplines within the app. We would promote this initiative across every African country and provide artists, designers, and creators in each region the opportunity to incorporate these QR codes into their work. For instance, a woman in South Africa wearing a piece of fabric with a QR code printed on it allow her friends struggling with gender-based violence to discreetly scan the QR code using a mobile device. This QR code would provide immediate access to the necessary helplines. The subtle nature of the QR code would allow the woman to seek assistance without alerting her abuser, effectively providing her with a secure helpline. By creating QR codes linked to the relevant helplines in each African country, we can harness the power of technology and art to enhance the reach of this crucial initiative and provide women with the discreet and accessible means of seeking assistance. We will be transforming this breathtaking sculptural dress into a dynamic NFT, a groundbreaking type of non-fungible token that can evolve and change over time. As we collaborate with communities in Africa who create exquisite crafts, the creations will be incorporated into the dress, further enhancing its significance. This remarkable NFT will then be auctioned at a prestigious gala event with the proceeds directly supporting organizations that empower women that suffer from abuse. This dynamic NFT dress will transcend the mere art, becoming a beacon of empowerment and social change. The Women of the Golden Thread projects stand poised to transform the lives of women across Africa, challenging the issues of gender-based violence and integrating a beacon of hope for a brighter future. We invite you to join us in this transformative journey. No matter how big and small, anything can make a difference. Following is a video of the Bright Armor campaign, so you can have a feel of how a creative idea can impact and make a lasting change. Please feel free to contact me with any questions regarding my project. Thank you so much.
Oh, thank you so much, Edward. What an amazing project. It sounds fantastic. How long has it been? When did you first initiate it? I'm wondering. I think you're muted.
Yeah, there you go. There you go. We've started about a year ago after we did the Bride Armor campaign, and we all come together and decided we really want to push this project because it's such a serious issue in South Africa and in Africa. So the next video will show you the actual ad that we shot for the Black Label campaign. Will we be able to get it up? Oh, thank you.
He was sweet, loving. He was everything I need from a man. Got married, and that's when he became more violent. He was a loving husband. So now she belongs to me. If they don't value, they will step you. When he's beating, he will do it where people cannot see it. I promise you, it's a monster. It's a monster.
Emshadweni wami angizange ngithole uphumulo, ngiphile nge-abuse. I got a scar, I got a scar, I got a scar. It's my husband.
Wow, thank you so much, Edward.
It's a pleasure.
Thank you.
It was a heartbreaking project to work on, but such a valid project, and there's a lot of voices that needs to be heard.
Very powerful.
Mm.
Okay, I think we need to move along.
Yeah. Okay, now I'd like to introduce our Frankie Heppel, our student perspective. Now, Frankie, who I'm sure definitely people in the committee have known, she's the person who's really helped to organize our conference, and she's a UN student with me. At Fordham, a second year advanced student, and she is placed with Close the Gap. And so she's working a lot with Peter Mandarin, on his project. And she's very knowledgeable. She worked for American Express for many years in London before moving here. And she is just been a terrific student. And we really felt it's probably very important to hear, a student perspective, on all of this. So I turned the program. Oh, let me also mention, Frankie has 2 teenage daughters. So this is a very interesting, important, especially topic for her, on the digital divide, and especially issues of digital security. So without further ado, let me turn the program over to Frankie.
Thank you, Dr. Congress. I'm just going to share my screen and then we can get started. Thank you for the kind introduction. It's lovely to be here this evening with you all. It's very grateful to be here talking on such an important topic alongside so many experts. As you've heard all afternoon this evening, there's been so much potential in using technology to access and help individuals and communities most in need, which is why closing the digital divide is so important. That said, as global digitization advances, so too must our understanding of how to ethically operate in a digital environment. This topic is important as I am currently studying for my master's in social work, as Dr. Congress mentioned, here at Fordham, and see firsthand how social work, its field of practice, institutions, professionals and clients groups are affected in many and complex ways by the digital transformations taking place across society. Closing the digital divide does indeed open new opportunities for many, but it also poses new challenges and problems. What I'd like to do today is kind of focus on social work and how social work ethics need to adapt and evolve so that we can now approach the digital era effectively and, most importantly, safely across the board. And this is true not necessarily only for social work, but arguably across all our different disciplines. And as we heard from Kristen earlier today, the advancements of technology are so fast and furious that we need to adapt in real time as we're going forward. So this first slide really is kind of here to sort of highlight how COVID really forced the hand for us to think about how to communicate virtually. This is certainly true for social work practice, where technology has provided many new ways in which we can communicate with one another. And what you see on this slide really is taken from the National Association of Social Workers Standards for Technology in Social Work Practice. And it illustrates the many new tools that exist, tools that do provide enormous opportunity, such as engaging with harder to reach or less mobile populations and the underserved regions, like we heard in the remote Australian outback earlier on in this conference, and indeed in Karela. And some of these tools could offer a sense of safety for clients by giving them more control over the environments by remaining remote, such as the virtual reality that Kristen mentioned in Therapeutic Alliance. There's also potential for mobile apps, like Edward just pointed out, and remote services to provide a sense of protection and anonymity that may influence someone to be more open and reach out in time of need, which is really important. And then finally, even email and text, even though we've had these around for some time, they can also support the development of a therapeutic relationship by contributing to positive perceptions of support. However, despite the clear opportunities and benefits that technology does present, social workers and all of us have called for clearer direction, I think, overall, for policies to keep practitioners and, importantly, service users, our clients, safe. And the reason really for this is working digitally often means remotely, as we've seen, which raises some key questions not only social workers need to address, but all of us in terms of ensuring safety in the digital world. So the next slide really just kind of gets to the crux of that. Like, what questions do we need to ask? What are those questions? For example, what do we mean by relationship? Clearly, in the social worker world, the social worker-client relationship is paramount and can be understood not only as an integral part of social workers' professional identity and purpose, but arguably also as the very core of intervention and of service in and of itself. When we talk about relationships, we usually mean, connecting with a client and developing a therapeutic alliance, like in the office or in person or face-to-face. We now need to relate to clients we may never meet in person. I mean, how does that redefine what we mean by relationship? The next question, who do we aim to serve? This really cuts to the very core of closing that digital divide, as we know that our dependence on technology can limit who we're able to serve with accessibility, affordability, and capability in terms of technological skills needing to be considered. And particularly, this is important as we look at this in terms of supporting women that are underrepresented in the technology divide. Next question is really, what do we mean by privacy? Face-to-face, we can more or less guarantee privacy, arguably. However, is that really possible when we're working remotely? For example, how do we know who's really listening to this conference today? And if indeed anyone's actually recording it? We don't necessarily. In addition, I think there is a question of practitioners' right to privacy, especially in the age of social media, where it's possible to find information about anyone, anywhere, anytime at the click of a button. Which clearly feeds into the next question: what are the boundaries of professional client relationships? For example, as a social worker, how do social workers respond to a client's Facebook friend request? Do you accept it? Would it be offensive if you did not, for example? I mean, and if you're providing services remotely, when does your workday end and when does it begin? And this is a question that relates to everyone. I think particularly during COVID, this was seen across the board, where people were burning out because they just didn't know where to begin and end on a day, because they were just stuck all day long and there's constant Zoom calls. And then finally, suppose the client sends a crisis-related message late at night. Is it okay to respond right away? Should you respond right away? Can you wait till the morning? Like, how do you address these particular issues? And then next question. How do we manage access to clinically relevant information? This is really, really important, because maintaining records is a core element of social service and medical professions, provisions particularly, including assessments, intervention plans, and follow-up reports. Very sensitive personal information about people. So consideration must be given on to how interactions will be accurately recorded, for example, and who has access, while always adhering to the many complicated data protection laws that exist around the globe. And finally, as Kristen so rightly pointed out, the big question that's on everybody's lips these days is, what role should AI and software development play in decision-making, if any at all? This is a real sticking point, because we work in the world of direct human interaction, and yet more and more technological solutions are getting in between that interaction, and often for good reason and actually helpful, but in some instances, we need to think about what that would do in that particular moment with that person. So the use of digital tools does challenge traditional notions of how social workers work. And indeed, it does challenge probably all of us in terms of how we work, which do have implications for social work ethics. So on the next slide, I wanted to go into a little bit more about what this is from an ethics perspective. And this just illustrates some of those ethical considerations. There's many, many more. And don't worry, I'm not going to talk to each of these. I'll be here all day. But that said, there is a body of literature that addresses digital ethics, not only for social workers, but for every aspect of society, as this is clearly a societal issue we are grappling with, and it's advancing so quickly. This is an issue we will grapple with going forward and need to be part of the discussion. For the purposes of today's discussion, I would like to reference an article that was written by a lady called Catherine Pascoe from the UK. Her article is titled "Considerations for Integrating Technology into Social Work Practice, a Content Analysis of 9 Professional Social Work Associations Code of Ethics," which seems like a good place to start. She includes in this study Australia, New Zealand, India, Singapore, UK, Ireland, Canada, the US, and the International Federation for Social Workers. But what is interesting about this article is there is significant variation across these 9 different bodies with the codes as they relate particularly to practicing in the digital world. I want to call out a couple of examples. Top left, a little bubble here on the right, professional competency. This is clearly fundamental to the reputation of social work discipline, and yet competence with technology has only really evidence in the more recently updated documents. Only 3 of the 9 codes highlight the importance of developing adequate knowledge and skills before adopting technology in practice. Secondly, right down here at the bottom, social media and electronic searching. Social media was the most common theme referenced across the Code of Ethics. Threats to confidentiality, professional boundaries, reputations were highlighted with recommendations on what to do, such as establishing separate online accounts for communicating with clients. However, using the internet to seek information on clients has gained significantly less attention in the 9 codes. Instead, social media use in the codes addressed the representation of social workers and keeping personal data safe, but failed to question or offer guidance on the use of internet search engines or social media surveillance to gain information. However, this practice is possibly widely used. For example, one 15-month participation observation study I reviewed, which looked at social work and child protection practices in England, highlighted that 65% of the participants thought it was acceptable to search Facebook to gain another view of clients as part of an assessment. Only the National Association of Social Workers offered the need to be transparent and only use the internet to source information in essential situations. That was the only reference to searching. This puts the onus on the social worker to navigate what essential means. And I think that really highlights that much greater clarity and guidance is needed for social workers, to managers and practitioners, to help them navigate their way through this digital minefield. The next example I want to call out is informed consent, which is really important to medical practitioners and social workers who are held to stringent informed consent standards, both face-to-face and online. This can become an ethical dilemma for online services, as the identity and capabilities of the client, for example, is not always accurately represented and can be difficult to confirm. And the question, especially tricky when it comes to parental consent for minors, because you don't know how old somebody is if you're just seeing somebody from a remote perspective. And finally, on the far right, on the top here, we already referenced this briefly before, but I want to highlight AI. This is the greatest grey area of all, with no reference in any of the codes of how predictive analytics or artificial intelligence should be used in decision-making. A much, much greater understanding is needed, as there is a tension between being shaped by and shaping technology, clearly, as we've seen. And attention is needed to ensure that clients' rights are upheld, and social work and medical professionals are key stakeholders in the development of such tools. As social workers' engagement with clients and first-hand knowledge of service delivery and systems, they should influence reviews and evaluations of existing and developing AI. Overall, PESCO concludes that there is significant variation across the codes with limited guidance offered, so social workers cannot really rely on the codes alone. So what needs to be done? The next slide really looks at some options. That's not all doom and gloom. There are some practical steps that we can take to ensure that we are digitally safe from an ethical perspective. There's 4 things here: technology and development, data protection, theory, research, and education and training. Starting the top left, we've talked a lot about technology and development, but to me, this feels like the most exciting, and we've seen how it can be used to be exciting, such as with Edward's app. It's forward-looking and speaks to the tension between being shaped by or shaping technology. I, for one, would rather shape it, but each of us, in that sense, should be key stakeholders in the development of innovative social technology solutions. As we are the experts in the field, we should be ensuring the needs of our clients are front and center, addressing central concerns including communication, relationships, community building, participation, and importantly, inclusion. Equitable inclusion across the board. Scholars stress the importance of dialogue between developers and digital tools and social workers. Rather than being passive recipients of new digital tools, social workers and medical professionals should take a more active role in participatory design processes with a user interface forward mind thinking. In other words, make sure that the person who's going to be using the devices, etc., at the front and center of how we design them. And then moving directly to the right, data management. Data management never really sounds particularly exciting, let's be honest, but it is fundamentally important. And adopting a small data mindset as opposed to a big data mindset is critical. And forgive me, Kristen, if I'm using the wrong terminology, but in my mind, what I mean by this is being mindful of how and where and when data is used, stored, and shared, and involving the client in every step of the journey. Data concerning clients of social work should be generated jointly with them wherever possible. Clients should be given as much insight as possible into the data generated, and clients should be comprehensively informed about the purposes and methods of the use of their data. Next, we jump to the bottom left, theory and research. And hopefully, I think this presentation has highlighted that there are many more unanswered questions than answered, which is why being human is so fantastic. But not only that, but technology and how we use technology is continually advancing, as Kristen has pointed out, which means further and continued theory and research is needed to address the intersections between media, social theory, social work theory, and ethical foundations of society. And finally, education and training. I can tell you that as a student here in Fordham, studying for my master's, that there is no direct courses addressing how to best practice in the digital environment. And we've seen all along throughout this conference that the digital environment is here, it's now, and it's very much part of what we do every single day. This is also reflected in the literature that I've read across the board. It's not really prevalent in many different institutions. It is incredibly important that more education is developed to equip students with the right tools in their toolbox to work digitally. Practical as well as ongoing discussion of theoretical and ethical issues should be included. In addition to that, ongoing recertification is needed for existing social work to ensure professional competency going forward. In summary, as we close the digital divide, there's a lot that we can do to address ethical considerations and ensure digital safety. And finally, I just wanted to close out today with a final thought and to end the session by really highlighting that while there's a lot of risk with technology, I'm sure we understand that, there's absolutely should be having these conversations as a result of that. There's also enormous amount of reward in closing the digital divide safely. As the quote says, manifold potential, and as we've seen today, that's an enormous amount of opportunity to create a world where access to resources and help is freely available to individuals, women and girls and communities most in need. Thank you, everybody, for your time.
Well, thank you so much, Frankie, for really talking about like really important issues that we should think of, just in terms of, of digital safety, for all. So that's about all, of our presenters for the conference. But now I'd like to have talk about, another project we're involved in. Besides doing conferences, we also have a newsletter. And we've put out a number of them, over the years. Pat Brunell has been our advisor for this, and Liliana Otero is a UN student, is working on the our newsletter now. And maybe Liliana, maybe you could tell us a little bit about the newsletter.
Yeah. Hi, everyone. My name is Liliana Espinosa. I'm the editor of the NETS newsletter of the Fordham Institute for Women and Girls. Well, before we start with the Q&A, I would like to invite the speakers and attendees of the events to write an article for the newsletter that is going to be published in March 2023. The mission of the Institute for Women and Girls is to promote the well-being of women and girls who experience poverty, violence, health problems, and workplace discrimination. Writing our article will be a fabulous way to contribute and get involved in addressing gender, age, and racial inequities and other topics related to women's rights to create awareness. You can also write about a successful story to inspire other women. I'm leaving the link on the of the website for the Institute in case you want to learn more. And I'm also adding my information on the chat. If you would like to write an article for the Institute for women and girls, please email me at lespinosaotero@fordham.edu and mention the topic that you would like to write. Just to give you an idea, the length of the article should be between 600 and 500 words. And we want to hear your voice. Please feel free to contact me if you would like to be part of the next edition. Thank you.
Thank you so much. And this is really an important way that you can continue to participate in the Fordham Institute of Women and Girls. I want to thank everyone for coming, and I hope you found it very informative. We were recording it. It will be available on YouTube. This is the first time that I'm meeting some of you, but hopefully not the last. We want to keep in touch. I want to have special thanks to all our speakers who were just wonderful, as well as to all the introducers. And as you can see, we had our committee members involved in introducing all the speakers. And also, again, I want to give a shout out to our IT team, Trish Rodriguez, Matt Roach, and Connor White, who really made it happen for us. We already are starting to plan for our next conference, which will be in March. In fact, we have a date and time, March 15th, 5 to 7 p.m. And this will coincide with the Committee on the Status of Women at the UN. So it's a very important event, a parallel event, at this conference. So we'll have a lot of more people from the UN participating, and we're already starting to, work on this conference. So, please, come to that conference, but join us. We are sending out an evaluation, and Christian's been working on this for us. And so please complete it, because we want some feedback about what you liked and what we could have done a little differently. I think that's about it, but please keep in touch. My email's very simple, congress@fordham.edu. So I hope that we can be talking more, and I hope that you really enjoy this conference. Thank you.
Thank you all for coming.
Thank you. Bye.